Infection control is an important aspect in keeping people safe in the healthcare sector. This is why preventing and controlling healthcare-associated infections is Standard 3 in the National and Safety Quality Health Service Standards. Infection control is also an important aspect to tackling difficult bacteria such as antibiotic-resistant bacteria. One of the 4 major leading antibiotic-resistant bacteria is MRSA. This is why we will focus on this superbug. MRSA stands for methicillin-resistant Staphylococcus aureus. It is resistant to antibiotics in the beta-lactam family, such as penicillin. The antibiotic in the beta-lactam family usually binds to penicillin-binding protein, PBP, which maintains the cell wall. However, MRSA consists of the MECA gene, which encodes PBP to PBP2A. PBP2A evolves the structure of the cell, preventing beta-lactam antibiotics from binding to PBP. Furthermore, its synthesis and division is enhanced with the presence of beta-lactam antibiotic. The MECA gene does not actually reside in the DNA, but on the Staphylococcus cassette chromosome known as SCC-MEC. The MECA gene is transferred directly from one bacterium to another via the horizontal gene transfer, which allows the rapid development of antibiotic resistance. MRSA can lead to several types of infections. These infections include infection of the skin and infection of the wounds, infection of the lungs, such as pneumonia, infection in the blood, which can lead to infections of the heart, and further complications could also lead to infections of the spine and infection in the joints.
Transmission of MRSA. Healthcare providers are main carrier of MRSA. The 2 modes of transmission are direct and indirect, such as skin-to-skin contact, infectious discharges, formalities, and unhygienic hands. On the other hand, some animals, such as pigs, other poultry, are considered as a mode of transmission of MRSA to human. Patients and visitors are at a high risk of MRSA infection from contaminated utilities in the hospital. So, nurses could help to prevent this infection using effective methods such as compliance with strict hand washing rules, screening and isolating colonized and infected patients at admission, sterilization and cleaning of instruments and equipments, fumigation of the room, safe health practice all the time, cleaning hospital phones and no mobile phones in the ward, and finally educating patients and visitors on MRSA. Data shows that 7% of hospital staff and 2% of people in the community carry MRSA. Generally, the incubation period for MRSA is up to 10 days. However, MRSA can live up to 8 weeks on a moped, 9 weeks on a cotton towel, and over 6 months on a blanket. MRSA can live in the skin of healthy individuals with no symptoms indefinitely. Studies show that about 1 in 3, which accounts to 33% of people, carry staph in their nose, usually without any symptoms. MRSA can be prevented, although not completely, but to some extent. It has been reported by the various studies that following CDC guidelines by the hospital and healthcare providers is the one of the main effective way to prevent MRSA. Healthcare facilities can implement wide ranges of effective activities to reduce and eliminate MRSA infection.
To promote infection control, we would like to introduce to you the use of UV light. The first product is called Glow Germ, manufactured in Canada. It is a visual tool to detect germs on surfaces and hands. It gets installed nearby the sink. Show your hands under the light after performing hand hygiene to test the efficiency of your hand hygiene. This application of UV light in the health sector has been more well known than the next product. Contaminated environmental surfaces are one of the significant contributing factors to the transmission of many pathogens, including MRSA. To resolve this matter, the invention of the use of the shortwave ultraviolet radiation is called 3D Smart UVC. It is a portable machine emitted UV light into the room with the target bacteria. The light covers all hard-to-be-seen corners, such as open drawers between cabinets. It is used to stop antibiotic-resistant bacteria from remaining in patient's room or creating new infection. UV light kills bacteria by destroying their DNA and is suggested to be most effective when being used with other cleaning methods such as chemical disinfection or ternary ammonium cleaning routine. Here are some cons about applying this cleaning method. Firstly, this is only manufactured by several companies, hence the price is up to $90,000 per machine. This is an additional 30 minutes of cleaning, which is equal leaving vacant rooms for 30 minutes. As a result, it is an uneconomic option from management's perspective. A huge impact on turnover rooms influences patients around these rooms. On the other hand, the trial successfully resulted in the effectiveness in infection control.
MRSA treatment. Now, because we've been using MRSA throughout this video, I will be using MRSA treatment as an example to demonstrate the consequences of poor infection control techniques. First of all, it's expensive for the hospital and for the wider community. Around $150 million was used up for MRSA-related expenses. To put that into perspective, that's roughly 2,300 grade programs being cut to cover that cost. Now, money and time go hand in hand. The number of MRSA cases has been growing since the 60s. Nurses already are so overworked. Without better infection control techniques, we're just adding another chronic wound patient onto your already tiring patient load. Also, some MRSA cases involve draining boils. Great for Dr. Pimple Popper and their Facebook page, not so great for us and our busy schedules. Secondly, majority of the experts say that prevention is the solution and the key. For example, many studies focused on MRSA treatment provide huge detailed lists of specific and strict antibiotic courses. We all know that golden age of antibiotics is coming to an end, so we should be using these medicines carefully. My point is, less cases of MRSA equals less antibiotics used, more time and money saved. Simples. That was me again, sorry. So, how do we prevent the spread of infection like MRSA? Well, sorry to sound like those hand hygiene online modules we all love so much, but please wash your hands. Best practice at the moment is with soap and water. It's better for your skin and you wash those bugs down the drain. Also, it's brief, it only takes a moment. If you're in doubt, just wash those phalanges, please. Next, aseptic non-touch technique. It's evidence-based. Governments like it and hospitals like it, so we're all covered. And we've been assessed on it, so we can somewhat trust our skills. And it's been shown to be the best way to manage a wound without spreading all that gunk and fungus stuff around. Okie dokie. Education. It's a very important and valuable tool. For example, community-acquired MRSA infections are much more aggressive than hospital-acquired MRSA infections. So how patients care for themselves at home will dictate whether or not they come back to the hospital. So it's important to sit down with your patient and educate them on proper infection control practices. Visitors have also been shown to not realize the effect of their actions or lack of actions, hand hygiene, and how it can have a devastating effect on other patients. Finally, kindly reminding other staff members to wash their hands has been shown to promote a workplace of safe and knowledgeable practice. We all need one of those.